Welcome back to part 2 of our videos on hiking. Just wanted to touch on the top 3 hiking injuries I see come into my office. After a big hike, it's normal to feel sore, but it's not normal to be in pain. A lot of times people come in with knee pain. So they'll talk about feeling sore or a sharp pain on the top of their knee or even on the side of their knee. And this has to do with excessive loading of the quads, usually during the downhill portion of the hike. We want to make sure we're stretching out our quads well after the hike. First thing we can do is use a foam roller to loosen up some of the fascia. So you're going to place it perpendicular to your leg. Use one leg at a time. It gives you better control and it allows you to really get into some of those sweet spots in your quad. You're going to want to line it up so that you have your weight on the leg that you're not using. And use it like a bit of a frog leg here to support the weight so you can really control how much pressure you're putting on the leg that you're rolling. And then you're going to want to move up and down on the foam roller, trying to find that sweet spot where you might feel a little bit more pressure. And when you find it, just hang out there for a minute and let the muscle melt a bit. Once we've loosened up the quads, we want to make sure we're activating the lateral glutes. That will help offset some of the pressure on the quads while we're hiking. So that when you're going downhill, you're not overloading here, you're actually using some of your glute medius or your lateral glutes to support you. On your head, I like to put one hand on my hip. That way I know where my thumb is the muscle that I'm trying to work. Straighten that top leg, flex the foot, and then you're going to lift up, straight up, in line with the rest of your body. You want to go to the level where you just start to feel the muscle pinch right here, and then lower down. You should feel a bit of a burn in this area, which is your glute medius. And of course, we always want to do these both sides. The low back often gets achy right across here due to being excessively tilted anteriorly in their pelvis. So what we want to work on is stretching out the hip flexor, which is pulling the pelvis into that anterior tilt. So this is my favorite, really easy to do hip flexor or psoas stretch. You're going to come down onto one knee. Make sure that your ankle is underneath your knee and that this knee is directly underneath your hip. You're then going to tilt anteriorly, so take your pelvis into a tilt. You're going to start to feel a stretch in this leg. Stay here and hold, or to accentuate, you can add a bit of a lateral bend with the upper body, reaching your arm up overhead. You're going to want to hold this for 30 to 45 seconds. In order to offset that pelvic tilt, we want to make sure we're activating the glute. So I like to use just a simple glute bridge to get these glutes active before a hike. To do that, lie on your back, feet hip width apart, tilt the pelvis so that the core is engaged, squeeze the glute, and start to lift up off the ground. This is not your yoga bridge where you're trying to get extension through your thoracic spine. This is about activating the core and activating the glute. So lift from the glute. Maybe you only get to here, maybe you get to here, or maybe you just start by setting. And is Achilles pain or calf tightness after a big hike. And as you can imagine, stepping up a steep grade is going to really activate and stress those guys. So we want to make sure we're doing a really good calf stretch. Find a curb or a wall, bring your toe up, and then as you start to lean forward with the hips, you'll feel a good stretch through the back of the calf here. In order to activate the soleus, bend the knee, and you'll feel the stretch come lower down into the area of the soleus. You're going to want to hold that for 30 to 45 seconds. If you find that these stretches and exercises aren't quite resolving your hiking issues, make sure you pop in to see one of your favorite health professionals so we can help determine exactly what it is that you need to get you back out on the trail, having fun, injury-free.